Hello and welcome to Conversations with Dr. Westman. Today we're going to be chatting about keto for beginners. How are you, Eric?
I'm well. How are you doing, Glenn?
Very, very good. Thank you. Eric, before we begin, just wanted to ask you a question. How long have you been in your clinic treating obesity, type 2 diabetes, hypertension, all these sort of conditions by using or with using a ketogenic or keto diet?
Well, if you count the original research studies, we did 22 years. So we started the research in 1998, and then I opened the clinic at Duke University in 2006. So our clinic opened about 14 years ago.
And basically, you've helped. I know that we've thrown this number out there a couple of times, but it's roughly 10,000 people to reverse obesity, reverse type 2 diabetes, fix metabolic issues like PCOS, fatty liver, non-alcoholic fatty liver disease, and various other hypertension and other sorts of illnesses using this approach?
Yes, well, I'm trained in internal medicine, which is the discipline in medicine that treats diabetes, high blood pressure, all these other chronic medical problems. And in the medical world, we're taught to use medications to treat these diseases. I became an obesity medicine specialist, which means you target the underlying or root cause of the diabetes and high blood pressure. And using the low carb or keto diet specifically, I practice better internal medicine than I could by using medications, because by changing to a keto lifestyle, you fix the diabetes, the high blood pressure, the heartburn, the arthritis, all these other conditions. You don't just manage them. So it's actually a great job to have. So after research, I created my own job, my own clinic, and we've been teaching other doctors how to do this for the last 10 years now.
If we try and break it down a little bit further, what is a keto or ketogenic diet?
Well, it's actually very simple. Keto may not be the best thing to keep in mind, although the name is very popular because it might make you think you have to do something with keto products and all that. You really don't. The most important thing to keep in mind is to keep the carbohydrates in the diet low. And actually you can do it in a difficult way. You can do it in a simple way. Because I've been in a clinic in North Carolina where I treat people of all walks of life, and they come back and ask me, if it's not working, I have to help them figure out why it's not working. I choose a simple approach. And so a keto diet really is a low carb diet that lets you harness the beneficial effects of ketones. Keto diet is I would call it an ultra low carbohydrate diet.
And what is it about the keto diet that actually is able to help fix a lot of these problems? What is it specifically?
Well, it was suspected for a long time, and now it's been nailed down scientifically that sugar and the elevated blood sugar or elevated blood glucose, so blood glucose elevation, is the root cause for obesity and diabetes. Of course, it makes sense. Diabetes is a condition of elevated blood sugar, so it kind of makes sense that you wouldn't want to have a lot of sugar. But the shift from worrying about fat in the food to worrying about carbs or sugars and starches in the food is scientifically sound. And so for most people, there's an automatic reduction in hunger when you start a keto diet. You don't have to count calories or be too mindful about how much you eat, because it automatically reduces the insulin and reduces the hunger. And that's why a keto diet is most known for its use as a weight loss or obesity treatment diet, because the hunger goes down, you get access to your fat store on your body, and you lose weight automatically.
And Eric, this is, as you mentioned, from 2006. This is something that you've refined over the years, and you've got a very, very specific protocol that's easy, sustainable, and it works on just about anybody. Is that correct?
Yes, and it's important to note that I didn't make this up. I mean, this is the science. What our group did at Duke with Dr. Will Yancey is we did the research to sort of validate, if you will, to publish papers showing that not only does it help with weight loss, it helps with all sorts of metabolic problems like diabetes, PCOS, all the things you mentioned. And so I learned from doctors who had used this approach for the last 150 years. It starts back in 1860 in London, England, and then doctors used this approach for diabetes 100 years ago. It's in all the textbooks. And then there were a few doctors like Dr. Atkins, Dr. Eads, Dr. Bernstein, Dr. Rosedale, who were using these diets when I got interested in doing research in the late 1990s. So I picked their brains, tried to make very simple systems that had been around a long time. So I guess you'd say the approach we use has stood the test of time and went through the validation studies and publications. When someone says, what about the blank diet, there's always a new doctor, and I said, well, show me a research paper in a good journal, 50 people over 6 months, and I'll comment on it. Our study with that level of information was published in 2002. So now it's so long ago that people who do PhD theses can't study it because they're too old or can't use that paper. So what we've been using has been around a long time. We've tried to make it simple and easy, and that's what people tell me when they come back. They had no idea that it could be so easy. So we want to lower the threshold of people worrying about doing something like this because it doesn't have to be hard. And if all you've done is a low-fat version, low-cal, low-fat, you're fraught with hunger, and that makes it very difficult. A low-carb keto diet cuts the hunger out for just about everyone in a day or two. It's almost effortless. And the science is there to back it up. If you're worried about long-term effects, don't worry.
So Eric, let me just get this straight. So you take people where they are right now. So it could be someone with type 2 diabetes, someone that has obesity, someone that has PCOS, someone that has non-alcoholic fatty liver disease, hypertension. You take them where they are now, and you give them a very, very simple process. I believe it's a 3-step process, and you take them to where they need to be or where they want to be to reach their goals in an easy and effective manner. And you spoke earlier on about the science, some of the papers that you've done, but I know that you've written, if I remember correctly, I think it's over 100 papers as we speak right now. It used to be 90. I know you've written a couple more. It's over 100 now. And I know that there's a lot of other science, not only that you've put out there. How solid and how robust is the science that we're seeing that's come out for the ketogenic or low-carb type of diets?
Yeah, so our role at Duke was to begin the research. And this is, our first paper was published in 2002. About the same time, Dr. Jeff Volek at the University of Connecticut, now at Ohio State University in Ohio, started researching it as well. The studies in the first 2000s, like 2002, 2004, 2006, 2008, were all low carb versus low fat, because low-fat diet was the prevailing champion, if you will. And so all of the research teams said, well, we're going to, pit the low-carb to the low-fat. And pretty much the score was 31-0 that the low-carb diet won in terms of obesity treatment. And so there's even an infographic at a website. It's hard now to teach all this information. But in a graphic form, the score is basically 31-0, low-carb wins. And it's not that low fat can't work. It's an important point. It can, but low carb is better. So, and we try to make that distinction that there are many ways to go about things. This one is just particularly effective, especially if you have insulin resistance, diabetes, or some other metabolic problem. But the science is so solid now. If, like, for example, there's a level of studies that are required for a drug to get FDA approval in the US, the Food and Drug Administration approval. These are called phase 3 trials. There's enough research now for obesity and keto diets that this would be approved like a drug. So it's safe and effective for the use of obesity and a growing number of studies for diabetes. But, you know, it's been used for 100 years to treat diabetes too. So you just need the medical monitoring for that.
Well, you know, I don't speak for myself. I speak for everyone and the whole community. We're all very thankful that you started the research when you did, and you've done what you've done to get the ball rolling, so to speak. So thank you very much. Let's move on to a couple of questions that I've got. I've got one question here. Jane asks, I've heard that a keto diet can help with fertility. I have PCOS. Is this true?
Yes. Yes. So our paper was published some years ago, and I see that repeatedly in my clinic today. So I'm still in practice seeing people with the concerns and issues that are happening today. Recently, one of my patients came back and was very happy to announce that her menstrual cycles had returned. And now that may seem like a strange thing to be excited about, but because of PCOS, polycystic ovarian syndrome, she had not had menstrual cycles for years. And so the metabolic changes that occur with a keto diet can actually bring back the ovulation or the menstrual cycles, and it can actually become a risk that you might get pregnant. And we often will tell people who are of reproductive age, you know, be careful. You may not have been very worried about getting pregnant, but now when you change, it's just changing the food, remember. When you change the food, you might actually become pregnant, be able to become pregnant. So, you know, if you don't want to, take some precaution. But yeah, that just demonstrates the power of changing the food. I mean, this can happen without really any weight loss at all. So that's one of the advantages of a keto diet, is that just changing the food has all of these improvements, and because you're not burning the sugar. And sugar burning is the root cause of so many problems. So basically you turn into a fat burning machine, and you don't have the same hormonal signals as you would from eating and burning sugar. And getting the fertility back is one of the benefits of changing to this way of living.
Another question I've got, Chase, from Damien, and this is something that a lot of, you know, people that are just embarking on this type of lifestyle, or they're wanting to, you know, learn more about the lifestyle. One of the biggest ones is what Damien asks. He says, should I worry about my cholesterol when embarking on this type of lifestyle?
No.
Well, that's the short answer. And okay, I mean, I knew that the answer was no. Anything to add on to that?
Well, you know, it's like there are 10 different levels of how I explain the cholesterol.
Give us the shortened version.
The short version is don't worry about it. Okay. So, but then the second version, which I hear a lot, is, well, my other doctor's worried about it. Well, they just haven't read the research, so don't worry about it. Well, but my other doctor now, you know, so you've been doing this a while. If you're losing weight and you check the cholesterol and it goes up, we don't check the cholesterol while you're losing weight. As an obesity specialist, we know that the cholesterol can temporarily go up while you're losing weight. It doesn't matter how you're losing the weight, but a lot of doctors will falsely think that that's a bad thing. Now, there is a number, you know, and you can verify everything I say today on you know, Dr. Google. There are a small number of people who have lost all their weight and their cholesterol goes up, sometimes massively high. It's very uncommon. And actually those people have banded together to do a research study to question, you know, whether it's harmful at all. So when you really do the deep dive into this, and I'm guest editing a journal right now where there are 2 papers in this journal that are about this. So that's like the level 10 of, if you really want to get into this, I can send you papers written by other scholars to learn about it. So the short answer is no, don't worry about it.
Okay. And I have a final question from Amanda, and she asks, how much weight can I expect to lose monthly? You know, these are questions you've heard so many times before. And, you know, for somebody that has an obesity issue, that's a big deal. That's a big deal for them. And a lot of these people have tried so many different diets in the past and they haven't worked. And, they might have heard, the miracles that people talk about with the keto diet and people losing this ridiculous amounts of weight. But what is the expected weight loss that you see in your clinic on a routine or regular basis?
Yeah, and one of the first things I mentioned is that don't worry yet about the weight. The first thing that has to happen is the hunger has to go away. So I'll explain that you start this all at once. It's a simple approach. We'll teach you how. The hunger will be gone in a day or two. That shows that you're doing it right. And then the weight comes off about 1 to 2 pounds per week. So you multiply that out, that's 4 weeks in a month. So it's 4 to 8 pounds per month. You multiply that out to a year, that's 50 to 100 pounds per year. No pills, no products, no surgery. So the first thing you'll notice is the hunger goes away. And I've been starting to say now, because there are all sorts of competing things and pills and product. Oh, can I buy this keto? No, don't buy those things. if what you're doing isn't working by 2 weeks into it, I ask my patients to email me, to come back to me, because it should be working by 2 weeks. Sometimes there's a water weight elevation. Sometimes you're on a medicine that makes the hunger persist, but it's so fast. Hunger's gone in a day or two, and 1 to 2 pounds per week of weight loss, which it's really unbelievable. Just changing the food.
Thank you so much, Eric. I really appreciate all this this information. I'm sure so will the people that are watching these videos. If you've enjoyed this video and you would like to see future videos, you can find us on our YouTube, Facebook, Instagram, and Twitter accounts under the name of Adapt Your Life. And if you enjoyed this video, please like or share it. If you're watching on YouTube, don't forget to hit the notification bell up above so that you can be alerted every time we put out one of our videos, which is normally on a Wednesday and sometimes twice a week. And on behalf of Dr. Westman and myself, this is us signing out for another episode of Conversations with Dr. Westman. Thank you, Eric.
Thank you, Glenn.